Okay, wonderful. We have started our recording and started our training today. We appreciate you all coming and consenting to being part of this. You will be able to use the transcription feature if you'd like to use that as well. All right, Isabella, take it away.
Okay, so today we are going to talk about anxiety, and I will be presenting along with my co-host, Miss Dr. Heather, and let's just jump right into it. So about me, I am currently a rising junior at St. Mary's College. This is a picture of me at my last orchestra concert. I'm currently an intern here at Allow Health, working alongside Dr. Heather. This is Dr. Heather and her pets. If you want to name drop your pets here, tell them a little about your pets.
Oh, sure. This is Murphy and Melody. They are lovely little fur babies that spend lots of time with us. That's their Christmas photo from this year.
Yeah, get to always see Murphy on the camera whenever we have our meetings, so it's really nice. This is my baby, Delilah. She's 3 years old. And then here is just not a creation of mine, but just to show that I love to crochet and just kind of do crafts like that and stuff, which you will learn that can be very useful for anxiety and helping with stress and coping. So, okay. So what we'll be talking about, we're going to talk about the myths, what anxiety is, how to recognize anxiety, physical symptoms, effects on the body, and what you can do to help somebody with anxiety. Also, to mention, I dropped a lot of memes in here to kind of just lighten the mood and make it easier to talk about anxiety, because it can be a hard topic and it can be really like nerve-wracking. So I just thought it would be like a nice little way to kind of bring everybody in and kind of draw everybody in. So, yep. Okay. Anxiety myths. So there are a lot of myths on anxiety, but we're just going to go through a couple that I feel a lot of people misconstrue a lot and would think it'd be true, but it really isn't. So if you have a panic attack that gets too bad for you, you can pass out. That is not true. Actually, if you're going to pass out, your blood pressure would drop. And because you're like panicking, your heart is racing, your blood pressure might actually go up instead of drop. So you're not really going to pass out. Always carry a paper bag in case you hyperventilate. You see this a lot in movies and stuff with characters that seem to be like anxious all the time and freaking out in social settings or in group settings. They always carry a paper bag, like especially in like movies where they are on airplanes. This is also not true. It can kind of help to like breathe. There are breathing exercises that you can do for anxiety, but it doesn't necessarily aid and help anxiety go away. If anything, it kind of reinforces your anxiety and kind of almost conditions you to feel fragile and like you can't have any control of your life, which is not true. And it just reinforces that anytime you're carrying a paper bag, you need it and that you're relying on that to kind of cope and get through the day. And that's not what you need. Let's see. If you have an anxiety disorder, it's important to avoid stress in situations that make you feel stress. That is just honestly not really possible either. Because if you always avoid stressful situations, then you'll never be able to live. And there are many people with anxiety who go through a day-to-day and they are able to kind of get through the day with their anxiety. They just have certain ways about doing it differently. If you avoid certain situations, you'll never be able to reach your full potential and achieve things that you know you can. So anxiety is not, you can't do anything. It's just sometimes you need accommodations and you need help to do certain things. Okay, medication is only the treatment for anxiety disorders, which is also not true. Medication is not the only way to help with anxiety. it is one of like many ways. We have behavioral therapy, we have meditation, you could do yoga, you could do like hobbies that help you distract yourself, you can do breathing exercises. There's so many things that you can do to kind of ease your mind and help with the worries and the stress, and medication doesn't have to be on the way. There's a lot of people that medication works for them, and there's a lot of people that medication doesn't work for them. It's not for everybody, but it is for some, and that's okay. If you want to take medication for anxiety, you would go see a professional psychiatrist to help you with that. But medication is not the only treatment for anxiety disorders. Some people are just worrywart or neurotic, and there's nothing that can really make any difference. Again, not true. People are not just worrywarts or neurotic. They have a chemical imbalance in their brain that just makes things a little bit difficult to kind of handle to a day-to-day basis. It's not that they're trying to be difficult, or that's just they can just stop at any moment and they're doing this on purpose. No, it's just sometimes they can't help it. There's literal physical and mental battles going on at the same time. So it's not just something that you can kind of put an end to it. It also puts a bad stigma on anxiety as well, making people with anxiety look like they're just almost crazy, or again, worrywart or neurotic, and they just can't slow down. So if you eat right, exercise, and avoid caffeine, and live in a healthy lifestyle, your anxiety will go away. Again, not true. It's not going to just disappear. Anxiety does not go away. This is not something that is like curable or something that you can just kind of wipe away or ignore. You will have anxiety, and although exercising, like eating right and being healthy will help, it doesn't eradicate it. It doesn't go away. It's still going to be there. Is there anything else you would like to add, Dr. Heather?
I think you hit a lot of great points, right? With thinking about these myths, we often just have these assumptions, right? All of these ideas about how we're thinking and feeling and what should or what must happen, where everything is a practice to be able to find that balance between the stress, the exercise, and what skill is going to work for each person.
Yep, exactly.
Oh, God, you got this.
Hope you like this meme. A lot of these memes are very
It's funny.
To the slides. I like this one. When somebody says don't be anxious and your anxiety is cured, kind of goes along with how they think that you can cure anxiety with like meds or just exercise and stuff. So I thought that was funny. Okay, now the big question. What is anxiety? So the DSM defines anxiety as excessive anxiety or worry occurring more days than more in for at least 6 months. Sorry. And a person could find it difficult to like go to day, and they worry a lot. Anxiety is also very worry based, and there are at least 6 symptoms to be classified for having anxiety. And we will get to that in the next slide. Anxiety symptoms. The symptoms for anxiety are restlessness, fatigue, difficulty concentrating, irritability, tension, and sleep disturbances. All these symptoms could be very normal, so it's kind of hard to distinguish. However, if it's, again, consistent more than 6 days and repetitive for up to 6 months, and it's affecting your school life or your work life or your social life or your relationships, it's something that you need to look into and see, hey, maybe I have anxiety. Maybe this is more than just me being stressed out. It's very common, and it's not something to be kind of overlooked and be like, oh, well, it's just I'm having a stressful day or a week or something. Like it can be a big toll on your body and your mind. Types of anxiety disorders. So there are many types of anxiety disorders, but we're going to go through these 7. So we have generalized anxiety. Generalized anxiety is the persistent anxiety or dread that interferes with your daily life. Most of these, again, also interfere with your daily life, but some of them can be more case specific, if that makes sense. Social anxiety disorder is an intense and persistent fear of being judged and watched by others. It can be so intense that it conflicts with everyday life. Again, imagine you're at school or you're trying to go to work or you're trying to interact with people. We're always interacting with people on our day-to-day life. It's hard to not interact with people because that's kind of where we are. We're always going around and seeing things. So having social anxiety can be hard and it can be a struggle because if you're always afraid of people and you always feel like they're watching you, it can be extremely stressful and kind of lessens what somebody does to a day-to-day basis. I could speak on that because I have social anxiety and it can be very hard sometimes, but I've learned to kind of deal with it over the years and I'm still working on it. But it definitely is no joke. Next, separation anxiety is the fear of being away from people you are close to or worry that something bad will happen. So basically, it's kind of like an irrational fear too, where it's like, so you can't see them, so you don't know what's happening. So now you're freaking out, you're worrying, you have all these thoughts racing, like, oh no, what if A, B, and C happens to them? Oh no, I can't see what's going on to them. I hope that nothing happens to them. Oh, I texted them and they haven't responded to me. I'm scared that something bad happened to them. Things like that is just kind of what spirals through their minds and what separation anxiety kind of does for people. It can be, again, very, very hard. Panic disorder, having consistent or unexpected panic attacks, sudden intense fear, distress, and loss of control with no clear reason or trigger. So what that means is basically just unwanted, for no reason, stress where you feel your heart's racing and you don't know what's happening and you're kind of your mind's racing and all the other symptoms of anxiety. And it's, again, very a consistent thing. It's very like random and sporadic and happens repetitively over days and months. It's not just like a one-time thing. Like you can be scared by something, like say you're scared of spiders and you see a spider, you're like, oh my God. But this is because you don't know why you're freaking out, but you are freaking out. Your body's reacting to something that you have no clear knowledge of. Phobia-related disorders are intense fear or aversion to specific objects or situations. It can be rational or not. Again, certain phobia disorders can be fear of needles or fear of heights. Those can be rational in the way that maybe you were not afraid of heights, but then suddenly became afraid of heights because something traumatic happened to you. Or fear of needles because, again, maybe you went to go get a shot and they did it wrong and now you were scared ever since. It's those things. But when it becomes irrational is you see it and you've never had any bad experiences with it, but you are afraid of it. Personally, I am very afraid of needles, and that is my phobia, and that can be very stressful for me. Yeah, it can be very stressful for me and very hard to control my anxiety, and I will start to panic and freak out. And I try to bring it in and control it, but it's not always easy. Selective mutism. It's a rare disorder which certain social situations leave a person mute and otherwise who can normally talk. So basically, certain social situations, kind of like social anxiety, when they are put in a situation where they have to interact and they have too much stress, sometimes it can leave them literally speechless, and able to communicate and talk with others, which can be really hard. And it's not like, again, they're choosing not to talk or they are mute at all. It's just something triggers anxiety, therefore shuts their body down and leaves them literally speechless. And then agoraphobia is the avoidance of stressful situations like public transportation, crowds, and leaving the house. So this one can be pretty extreme because, again, if you're not leaving the house, it can be really hard because you can't get like certain things you need, or maybe to go get out like groceries or shopping or getting food and clothes. And if you are so stressed out that you can't leave your house, it can be really hard to leave, especially if you can't interact with people. Like even if you just get mail, or like say you order something from Amazon and they dropped off the package, it'd be really hard for you to interact with them. So yeah. Okay, how to recognize anxiety. Anxiety looks like shyness or feeling distressed in new situations, effects of stressfulness in negative life events, history of mental disorders, like history of having anxiety in the family, difficulty concentrating, restlessness, loss of control, and physical symptoms. So for the first one, I feel it can be very misconstrued sometimes, because just because the person is shy doesn't always mean they have anxiety. The shyness can come from many different things. However, if the shyness kind of continues and persists like from childhood and growing up, and they're very like avoidant with like certain social interaction stuff, that could be a sign of social anxiety, or that certain situations really stress them out and freak them out, and it's really hard to deal with change, hence the anxiety. So I feel like that one's a really big one to point out. Unless you have anything else, Dr. Heather, about recognizing anxiety.
Yeah, I think what you're kind of bringing up is the difference in how anxiety might look in someone that's younger, but then also transferring that into how it's going to look when you're older. So you might be shy when you're younger, and then you can be really extrovert when you're older. However, still having maybe that anxiety with very specific people or certain social situations. Maybe your family is just known for being worriers, right? I think that's like really common too. You're like, oh, in my family, we all just worry about each other. And it can be really complicated and hard to get to that concentration piece or the restlessness. Maybe you move around a lot, get up and down. I feel like for restlessness, I often see people that like to clean, right? They're like, I can't sit still. I have to go clean or do the laundry, go rake the leaves. I don't know, whatever it is that you feel like you need to do. And it just causes you to feel a little bit more out of control, even though we're looking to feel in control.
Yeah, I could say definitely on the restlessness that sometimes it's like your mind is racing, you have a million tasks that you want to do, and sometimes you're kind of just jumping in between them and just trying to pick one, or just like physically restless, like there's an urge to kind of just tap or keep your body moving, and it's kind of not staying still. And then like the loss of control can just be more of a mental thing sometimes, because it's like you feel like you can't put your thoughts in order, and it's just all spiraling. So it can be kind of like a mush of just anxiety, basically. So yeah. The physical symptoms of anxiety. So again, being physically fatigued, irritable, you can get headaches, muscle aches, stomach aches. I would say when stomach aches or sweat and unexplained pains, especially with those big stressors, like what under like certain like when you have those panic attacks, it can feel like your chest is tightening almost too, and it's hard to breathe. And it's just, especially in the other ones that cause like the unknown stressor, it can just kind of come out of nowhere, and you're like, oh, I'm not feeling good, but it's not because of like I ate something bad, it's because I'm really stressed out.
Yeah, and I think what you're kind of hitting on is that differential diagnosis piece. So that's where, as like a counselor and medical professionals, we have to put together all the symptoms. Because oftentimes we'll have somebody come in who says, "Oh my gosh, I'm having chest pains," and they've actually like gone to the hospital and been evaluated for cardiac distress, and it comes back that there's nothing going on with their heart, and those chest pains or a panic attack are often able to be more explained by anxiety, which isn't easy, right? Sleep problems. So many things cause sleep problems. So many
Yeah,
things cause that heart arrhythmia, all of those things.
thyroid problems also is here. Yeah, with sleep, it's again Things like it's keeping you up at night. Maybe there was something you did wrong on a test and you really regretted it, and now you can't stop thinking about it. It's running through your mind. You're like, oh my God, I wish I would have done A, B, and C, but you can't take it back, and it just keeps on going, which kind of goes into the loss of control, and it can be a mental prison. So
Yeah. Shoulda, woulda, couldas maybe happen, might be.
yeah.
Could happen tomorrow. How about next year or 20 years from now?
Yes, a
Right.
lot of scenarios too. So
Scenarios.
yeah, it can be hard to sleep. Okay, the mental symptoms. So again, there's a lot of difficulty in controlling like those intrusive thoughts, feeling worried, having a hard time concentrating, feeling like you have no control of your life, and those repetitive helplessness thoughts and dread and worry. So it's just kind of, I like to think of it as just kind of a circle that kind of crosses over in many different places, but kind of connects and it all goes back into the same place. You start at A, you might go through like the whole alphabet, but you come back to A because you're just kind of going and cycling. And so maybe your mind quits or you're just tired, but it can be very draining and be very hard on the person mentally and physically because the mental can transfer to the physical. If you're putting that much stress on your body, you keep thinking about it and thinking about it and think about it. I mean, you can literally make yourself sick because of how much stress you're putting. I mean, your body is constantly pushing out messages through your brain and electrical signals, and you're also pushing out all these hormones. And if you're having all these imbalances, then it can be really, really difficult to kind of feel okay and not sick or just like having those headaches again. So it's a battle. It's a battle of both physical and mental. And like the meme says, what if this happens? But it won't. But what if it does? So it's pretty much like that. Okay, so the effects on the body. There's a lot of underlying health conditions. You have like heart disease, thyroid, respiratory disorder, chronic pain, irritable bowel syndrome, rare tumors, stress buildup, fatigue, restlessness, and headaches. So again, the stress buildup is again from most of the mental symptoms and the stress that you put on your body that can literally kind of deteriorate yourself throughout the years if you don't find proper ways to cope and seek help, or if you wanted to do medication or just anything to deal with those daily stressors, depending on the kind of anxiety that you have. So here are some anxiety statistics. Okay, so an estimated of 31.9% of adolescents have an anxiety disorder. That's a pretty big number. Pretty, it's small but big. Like if you think about it in general, not everybody has anxiety. We all have anxiety in the tiniest bit, but with anxiety disorder, it's like increased by a lot. And so it's not uncommon to have anxiety, but it's also not like everybody's gonna have anxiety. Like you may not have anxiety, but the person next to you might. Um, Adolescents with anxiety disorder is estimated of 8.3% have severe impairment. The prevalence of anxiety disorder among adolescents was higher for females than for males. So that doesn't surprise me. A lot of things can be found a lot in females, like anxiety. Estimated 31.1% of US adults experience anxiety disorder at some time in their lives. Also, a thing with these statistics I feel that kind of shows is that a lot of the reports we may be missing numbers because a lot of people have the stigma of anxiety that it's not real and that it's just, oh, you're nervous or you're anxious and it's just like nothing to worry about. So a lot of people don't kind of go and evaluate themselves, or they're adults and they've been living through it their whole lives and they're like, whatever, I can do it, I'm fine, I'm just going to keep going like that. Or they're kids and the parents are just like, they'll grow out of it. So it's a lot of those numbers that honestly it could be higher, but we don't know. But this is kind of what we get from people who kind of tell us. And so yeah. What to know about anxiety. It's not a disease and it's not something that can be cured. Again, it's not like a major illness that's going to kill you or something. It's just something that makes life a little bit harder to deal with. It kind of is just the reaction of certain stressors that may be rational, may not be rational, may have something to do with certain like aspects of your life, or just have to do with everyday things in your life. Um, Anxiety is real and is also not something to be insensitive about or ignore. If you know somebody with anxiety or may have suspicions that somebody has anxiety, it's not right and won't help them if you tell them that it's not real or make them feel like it's all in their head, which in a way it is, but not in the way that you think. It very much is existed, and that it affects how they go through things. And what may not be stressful to you could be stressful to the person next to you. And it's not like they can just kind of flip the switch and make it all go away. So it's something to be kind of not cautious about, but acknowledge and be not ignorant about. So in 2023, prevalence of anxiety disorder was higher for females than males. Okay, that we said that. So what you also want to do is don't tell somebody with anxiety to relax or calm down if they're having a panic attack. Help them work through it. Help them maybe do a breathing exercise. Make like make them feel comforted and help them get to a level where their body can kind of relax and just calm down, because we have a natural um way for our body to kind of just calm down. But in these kind of situations with a panic attack, your body's kind of shooting up, your heart's racing, your mind's racing, you can't stop thinking. And sometimes you just need somebody to help you kind of get back to that state of homeostasis. And that's not easy when somebody's telling you relax, when you're already trying to tell yourself to relax and calm down and stop freaking out or not worry about it. It just makes things worse. So don't do that.
I can take the last one if you like. So we're thinking about our last point here. This is from a research article that talks about the differences in stress, and that in some research, minority stress has been shown. So that's a person of color that has been part of a research study, has been shown that there might be what's called, they're calling it traumatic invalidation. So you're having stress, you're anxious, and things come up, and somebody just says, like, as well as just saying, oh, that's no big deal, just leave it alone, and really invalidating that somebody has real feelings and it's a problem for them. It's really being aware, even by race or by gender, things are different, and being aware of how invalidation can even increase anxiety more. So if you don't understand what someone's going through, at least listen, right? Be curious about what's going on with them versus making them feel bad or make an assumption. It can be very invalidating.
Yeah. Hit it all the way, hit all the points. So how can you help somebody with anxiety? You want to recognize anxious behavior in yourself or someone else. You also want to ask one time, you want to ask yourself, is this a one-time thing or does it happen often? You also want to see, does my anxiousness affect my relationships with people? Are there certain situations I have a hard time controlling my worries over? When do I feel okay or safe? And how can I help myself or someone else? You want to look at these signs because these kind of are tells to kind of maybe go seek help, professional help. If you're having a hard time with relationships and maybe the anxiety and stress is becoming too much for you, maybe it's because it's not just normal stress and everyday life worries. Maybe there's something else going on. If it's again happening more than once, like happening almost every day, or like it doesn't even have to be like consistent days. It could be like one day you're having like all this anxiety. Next day is like fine because everything's going well, but then the rest of the days are really bad, then maybe something is wrong. And then yeah, that's pretty much it actually. Treatment for anxiety. Again, we have medicine, which is the antidepressants and anti-anxiety meds. A lot of common ones would be like Zoloft, which is also sertraline, which is again an antidepressant, which kind of works to help anxiety and depression, and they kind of go hand in hand sometimes because with depression you have all kind of again these stressors and the anxiety behind it that kind of fuels that kind of dark space, if that makes sense. If you can elaborate, Dr. Heather.
So we're thinking about medication. Is that what we're talking about, right?
Right. So how?
So I'm thinking about with that, just being aware of that there's so many different kinds of medications. A lot of them for anxiety, even depression. You're talking about antidepressants. They can take like 6 or 8 weeks to even be effective. There are some short-term medications. They're called benzodiazepines. The downside is they're really addictive. So no matter whether you're seeing a psychiatrist, a nurse practitioner, a physician's assistant, or even your like primary care doctor, your general practitioner, you really want to talk to them about what are the long-term effects and the benefits. So a lot of times people can take a medication for a little while, get the skills in place while they're taking the medication. So let's say do the cognitive behavioral therapy, or even in our case at Allow Health, I'm certified in what's called dialectical behavioral therapy, or DBT. It has cognitive behavioral therapy inside of it. You can learn those skills while you're on medication, right? And then get off of it a little bit later once you've learned everything. So it's going to be often given in a group therapy setting. There are support groups. There's a lot of free ones out there. So they're not just for AA. There's emotional support groups. They're literally called emotional support group. A lot of them are free, but therapy groups would be provided from a clinician and billed through insurance. So support group is kind of out in the community, where group therapy is through like a practice or a clinic. Then we have the stress management techniques. We've touched on mindfulness. Isabela knows I'm big on mindfulness.
Yes, the mindfulness.
And exercise. I prefer to get up early and exercise, but some folks like to exercise in the evening.
Yeah.
Just find the times that work for you. Do something detailed with your hands, right? We talked about your crocheting.
Yeah. I'm not a morning person, so the exercise in the morning is not for me, but later in the nights, I'm very much a night owl. I said the breathing techniques earlier, those are also really good. If you like that, or like yoga, anything that kind of helps manage stress or calm you down. Some things are not for everybody, like the breathing or the yoga. Maybe you don't want to kind of try to stretch and like flex out. Maybe you want something that's kind of chill and you're sitting down, like crochet, or maybe crafts, or maybe just like video games. Sometimes video games can be good for stress, depending on like what do you like to enjoy to play. Exercise is also really good. You go now it's summer, you could go swimming,
right? Just go outside, go on your bike,
get a floaty and just kind of sit there. So a lot of these are really good for anxiety, and it's not just medication. And then here's some anxiety memes to kind of close up the presentation. So waiting for anxiety to go away, kind of 15 minutes, hour, 2 hours, eternity. My anxieties have
anxieties. I love that one. That's so funny. Charlie Brown.
So I feel like this is a very good example of what, like, again, how people see anxiety. Like, it's just worrying and all that, but anxiety is like all these other things, not just like worry. It's like all these that make up the circle. If you have a friend that suffers from anxiety, stop telling them to relax. Again, big no, do not do that. It does not help. Never really helps at all. Just kind of mean. The human body is 60% water, so we basically are just cucumbers with anxiety. And I really love pickles, so I think that was really funny.
You had to include it, right?
Yeah. So then this one, surprise, it's a panic attack. You never see it coming. It just kind of, again, comes like a little present. And then this is a little frog. He's like, you always seem so chill. Me externally. Oh, thanks. Me internally. And then screaming. So we have anxiety girl. I have no idea how to think. I have no idea how to not think. And then my right is here, and then the license plate's anxiety, and then all these other ones. When your life's a mess already, filled with crippling anxiety and depression, yet you sprinkle some procrastination for decor. Yeah. And now we're kind of to the last of it. So if you guys have any questions, you could put it in the chat, put it in the QA, and we'll answer them for you.
Thank you all for coming and joining with us.
I appreciate all the support and everybody coming today. This was really, really fun. I actually really enjoyed putting these slides together because I got to pick all the images. So, yeah.
Thanks, Cami. And we're getting some love in chat box.
You can put a little smiley face.
Oh, that's nice. That's nice.
I believe I have some other memes on my sources too, if you guys want to look at that.
Oh, look, I think we have a question about the statistics here in the chat box for you.
Okay.
Let's see what it says.
I'll let the memes kind of, I want to leave it on the last one.
Oh, okay. So can you elaborate the main signs and symptoms between general anxiety and mental health disorders such as OCD? So general anxiety, as the title describes, is more general. It's kind of like overarching, whereas OCD has a obsession and compulsion piece to it. So someone who has anxiety might think a lot and have racing thoughts, whereas someone with OCD has those thoughts and thinking, but they have an action or resistance to an action that goes with that. So compulsion to do an activity, compulsion to do a ritual. Oftentimes we think about like washing our hands or like setting up stuff in a certain way, like somebody with OCD would want it all set up in that particular way, and if it went awry, it would just ruin their whole day. Whereas general anxiety would be kind of more overarching. I'm anxious about doing these things. If it didn't happen, I still don't feel great. However, they don't have that obsessive thought about it or compulsion to do or not do something. Hopefully that answered your question. Let me know if you need more. So how do they compare to, say, 20 years? Oh, the stats from 20 years ago? Oh, I don't think we researched that. That would be research. I'm not sure what the difference of anxiety has been over the last 20 years. I know that in adolescence, mental health symptoms have risen more than 50% in the last 5 years. As for adults and as the community in general, from what I've seen, I think that people are more open to talk about mental health. So although there's a rise in, we'll say, diagnosis, from I think all of our experience in the world, it was around 20 years ago, right? However, people maybe were not seeking treatment or understanding what the triggers or symptoms were. So I think it's more the knowledge that we've been gaining in the past 20 years, it's increased the ability to diagnose and normalizing seeking treatment. What was it? We had the Mental Health Awareness Day, right?
Yeah.
Isabela, that we posted about on our social media. And that whole day was brought about several years ago in response to people seeking treatment after being away for war. So it's just really bringing that awareness and normalizing that it's okay to have these things. It doesn't mean that you are like rubber stamped a bad person.
I think I would also think about the statistics is that compared to like 20 years ago, a lot of people are kind of speaking up more about it. And again, realizing that maybe they do have it instead of just trying to cover it and call it something else. I think a lot of it now is that there's more knowledge and information to be kind of spread out about anxiety disorder, that it's kind of more easily spotted than it was before 20 years. So I think that's why also the statistics may have changed over the time. So yeah, it's another big factor.
Yeah, I'm thinking about like agoraphobia as well. Like there's probably somebody in your neighborhood that you're like, oh, they never come out of their house, right? Like 20 years ago, and nobody would have said, oh, they have agoraphobia. Like now we would have more of that insight to say, hey, that person has agoraphobia and they're choosing to stay home because they're fearful of, as we were saying earlier, transportation, something bad might happen in the community, anything like that. But you let us know if you have more questions about what we responded to. So how can I support someone who is experiencing anxiety? Do you want to take that one as well? Do you want me to take it?
So again, from like our previous slides, so when dealing with somebody with anxiety, again, one major no is when they're like, if they're having a panic attack or something's really stressing them out, you don't want to push them into the thing that is stressing them out. Or in the case of the other disorder where panic disorder, where it's kind of just unknown and it's just sudden, you don't want to, again, you want to kind of figure out what it is, but again, you might not be able to figure it out. So you don't want to push that person more and stress them out more. In the certain situation, you want to help them breathe. You want to help calm them down without telling them to calm down. You want to be there for them and not make them feel like they're crazy or feel like they're alone. And you don't want to make them feel bad for going through what they're going through. Sometimes it's just kind of not up to them how it and when actually it's never up to them how when it happens, because it just happens. It's your body's natural reaction to the stress, and it's just really hard to kind of stop feeling anxious or stop having that panic attack. Another thing is certain, again, with the certain exercises, or maybe if they're feeling anxious, reassure them. If they're anxious about a test and they really want to do good and they want to like excel, even though they might not be able to, you want to make them feel like, hey, okay, you're really stressed out about this test. I'll help you study. We'll go through it as many times as you want. Or hey, you're overthinking something. Let's think about something else. Distract them. Give them something else to think about that won't keep them in that cycle and keep them in that loop that they feel trapped in and they lose control. So, I think also we got a question: can anxiety be triggered or is it inherited? So, it's a hard one.
That depends on the researcher that you read the articles about. That's what I will say. There are different schools of thought. Some people say there are some genetic markers out there, whereas other people would say it's environmental, like something you've learned, something you've been conditioned for. I'm more in the school of thought of kind of put everything together. So nature and nurture, let's put all of that together and see where somebody's at so we can learn how to be new and different people versus blaming it on one thing or the other. It's happening. And just knowing that with skills, it can reduce any of the symptoms that are occurring for somebody. Oh, does physical contact help or make it worse? Hugs or touching a hand? That is specific to an individual. You'll have
Yes.
to ask them.
That is very specific to the individual. I feel like personally for me, it can depend on the situation sometimes, because if it's too much, then I don't want to be like touched for like a hot minute. I need space and being able to kind of just feel my own body again, because it just feels like a lost control. But sometimes it can be helpful, like maybe they're freaking out, maybe they just need like a tight embrace to like make them feel like they're secured and there's somebody backing them up. Or even like you said, touching hands or like holding their hand just to like kind of reassure them. I know when like I have to go get shots or like the needles for me, I know it helps me to like sometimes listen to music and my ears kind of try to distract myself. Or some people it helps like you can hold their hand in that situation. It really just depends. And again, like Dr. Heather said, it really depends on the person. So it's kind of you want to see what makes them comfortable and what kind of makes them feel reassured and calms them down.
Yeah, it definitely depends. For some people, physical contact is going to be the best thing, right? And then it might even be good for somebody one day and bad for them another day.
Yeah.
So
Sometimes you could just talk them through it. Like, hey, you want to think about something else? Hey, you want a distraction? Hey, you want to do A, B, or C? Kind of just it's very situational and it's very based on the person.
validation goes a long way too. So, and with all else fails, listen and validate. They might not even know what they need in that moment if they're having a full-on panic attack. I know sometimes you might think about it in being like a meltdown or an outburst too. Any of those times, it's really kind of checking in and assessing what's going on in the environment. Maybe you want to keep them safe, move them into a different room. If someone's driving, like let's pull over and take a moment, any of that. See, we have another comment coming through. Oh, good question. Is there any studies that indicate anxiety causes sleep apnea too? That's part where you stop breathing. You know, I haven't seen anything directly myself that says anxiety causes sleep apnea. I could say that I've had worked with a lot of people that have sleep apnea that do have anxiety. So there definitely is some sort of relationship in general between a sleep disturbance and having any other sleep disorder related to like anxiety or depression. You're more likely to have some sort of sleep disorder or symptoms if you have anxiety or other mental health diagnoses too.
These
So
are very
the stop the breathing part is definitely more of a physical response, right? That would be definitely more medical than mental health.
Yeah.
Good question, though. All right. Well, as we're coming to a close, we just really appreciate that you all have taken the time to join us. As Allow Health continues to have our interns, you'll be able to watch out and see some more of these from our fabulous students entering the counseling spaces to work with their future clients as they're learning the ways. Yep. So I really just appreciate you all joining us and thinking about how we can all allow health into our lives. See, we have another comment coming through from Rich. Oh yeah, thanks so much. Any other things you want to say as well before we finish?
I think I want to say that again, there's a lot of stigma on anxiety, and sometimes a lot now. There's a lot of people who try to claim different types of disorders like anxiety, and on social media where they try to post a lot of false information. So in those cases, you want to kind of do your research and talk to like actual professionals. And you also kind of just don't want to self-diagnose yourself. And I feel like some of the slides kind of sound like here's the warning signs, but it's also like you don't want to get yourself worked up over something that you may or may not know it's true. Hence why you want to go to a professional and seek professional help and see if that's actually the case. You don't want to jump to conclusions and be like, oh, I have anxiety. No, you want to go see somebody who actually knows what they're talking about, who can actually tell you it's true or not. You don't want to kind of bring a negative kind of connotation to the people who actually have it and kind of go through it, because it just takes away from the real people who are actually struggling with anxiety disorder, and again just puts that negative stigma and doesn't let them be believed by others. It just kind of pushes them aside and says, oh no, you're just worried or you're just neurotic or any other thing. So you got to kind of keep that in mind. You want to be mindful. That's in mindfulness.
Yes, mindfulness is key. All right, well, I think that's all for us today. Again, we appreciate you all so much for coming and just learning some more about anxiety and what's going on with our mind and our body and those connections. And we hope that you all have a great day. That's it for us.
Yep, that's it.
Thank you so much.
Thank you.
Yeah, bye, everybody. All right, I have stopped the recording. Stop. You are now only recording this meeting. I said stop.
It doesn't want to stop.
Oh, it just started it back up. Sorry about that.
We can edit it. We can just trim the stuff that we don't need at the beginning and the end.
I know. So it's like, stop. Transcription. You are now only recording this meeting.
So are we going to put the recording on like the Allow Health website? Because that would be a good idea. Just put it on there.
We can kind of feel it out.
Yep.
I don't think it's recording anymore. It says start. You did it!
I think that was definitely more than 30 minutes that I was talking. So I was proud that it actually lasted longer than I thought it was going to.
Yeah, I was like, ooh, she's getting to the 30-minute mark. I know that was her goal. And then I was surprised all the questions. Did you know this other person? I think we did have a stranger in here. Was that Garcia person?
No, I knew everybody except for
No,
the person that you brought in. I knew Kiana. Okay. I knew the other Isabela, which is my best friend. And
okay, good. Well, then we knew everybody. This doesn't matter.
Yeah, we got everybody.
Doesn't matter. It's good practice. That's the whole purpose. That's why I wanted you to, like, why I always have students do this, because I mean, look how much better you feel after it's done. Like, you're gonna be crushing it in presentations now.
Yeah, for the most part. I honestly forgot to read the scripts. I like started to occasionally look at it, and then I read the slides, and I was like, brain thoughts. What do I know? And then I just kind of said it.
Yeah, I mean, it's good to have all that stuff there in case, like, you get like lost. But it's, you know, it's fine.
We did it! Yay! I don't have to do this again.
You're done. You're done. You're done. You're done. Yeah. So
put this on the resume. Like, what do I like? Do I just like? I did a webinar.
Yeah, you did a webinar. So you would put it, like, I can. So what I have is this thing called presentations, and then you would put it like you would cite it just like you would like APA style, and then at the let me get my thoughts right. APA manual does have like a description on how to cite it, but that's how you would do it, just like you would an article for a paper, and then you would write the location. So you would write the virtual Allow Health webinar and the date.
Oh, okay.
So if it was more like a conference, like we actually had an official conference, you would say like the conference, the city and the state that it's in, like the conference title, city and state. So you could do Allow Health webinar. You could put, because we're based in Baltimore, you could do Baltimore, Maryland, or just put Maryland because it's really online, Maryland
Yeah.
and then the date. And they'd be good to go.
Yay, got it on there. I gotta update my resume because I haven't done it since I joined, or I joined Wawa. I got my job. So
Yeah, it's put this on there, put this on here for sure, because that'll help you. That's one of the reasons why that'll help you for your
gotta put it on my
master's
LinkedIn and
application.
everything.
Yeah. Put
Gotta
it
update
on
my
there. And then now you have a recording of a presentation too, like how you interact, right?
Yeah.
So it's good. It's good. I'm happy
Yay.
for you. It happens. You made it to the library and so success.
Yeah, in the library. Oh my god, yeah, that was great.
All right. Well, are we good to go for Monday? It's a meet and greet. Are we good?
When's
Yeah, we've been focusing on this. Monday's our next like supervision time. Are you good for Monday?
Am I
Are you
working
busy?
Monday? Let me check. They
Sorry.
have my schedule like absolutely insane next week, I think. I'm like,
So it's the 3rd is Monday.
they have me working 12 to 6:15. Weird
Okay.
time.
Well, I guess get your schedule and let me know, because I know we only scheduled through May because we were gonna figure out what to do as we're completing your year for the summer here. So if it ends up being like summer's kind of crazy, we can, if you still want to finish out, we can still like meet here and there and make sure you're on track each month.
Yeah.
And as I'm figuring out all this HR stuff, as I am getting everything set, I will let you know what's going on with that. I had another meeting with them today. I'll tell you what, I do not understand half this stuff. I'm like, a what? I'm like, it's like talking to Charlie Brown. So I'm getting all that stuff set up. And hopefully I have just had 3 students reach out. They're all master students. We got to find some undergrads for you.
Yeah.
So hopefully we'll get the intern thing going up soon. So I know the next post is for Pride Month, right? I don't think you did it yet because you're focusing on this. So Pride Month, and then you want to do some intern flyers. You know, those are the 2 that you're working on right now.
Yeah.
So we'll be all set.
Yep.
So message me when you know what your schedule is, and we'll set up either for next week or the week after. So I know you get everything set up. Sound good?
Yeah, they got all over the place. It's hilarious. Like next week, I am working 34 hours.
Whoa, that's a lot.
Yeah, it's like spaced out, I guess, but just like really weird time, honestly. I think it's funny with the added extra 15 minutes, like 34 hours and 15 minutes. Okay, guys. But, you know what? It's okay. I was happy about Memorial Day because I got paid double. So that's me.
Enjoy. All right. Well, I will see you when I see you, and we'll talk soon.
Yeah, bye. Thank you.
Bye. You're welcome. Thank you.